Ever feel just trapped by this constant, overwhelming worry? We're about to break down the real difference between everyday anxiety and a clinical disorder. Or maybe you've been hit by a sudden, intense wave of fear that comes out of nowhere. We're going to unpack the specific symptoms that define that feeling. And, maybe the most important question of all, what actually helps? We are covering the evidence-based treatments that really, truly work. Okay, let's get right into it. We're going to get a really clear picture of generalized anxiety and panic disorders, taking you all the way from symptoms to effective solutions. Hey, welcome to Medorythm. Our whole goal here is to give you clear, trusted health information on the topics that really matter. If you find this helpful, do us a quick favor and hit that like button and subscribe for more. So let's be real, everyone feels anxious sometimes. It's a completely normal human emotion. But when does that feeling cross a line? When does it go from just worry to a diagnosable disorder? Let's clear that up. And right here, you can see the core difference. On the one hand, you've got generalized anxiety disorder, or GAD. Think of it like a constant low-level hum of worry in the background about, well, lots of different things. It's chronic. But panic disorder, that's totally different. It's all about these sudden, sharp spikes of intense fear, panic attacks, and then living with the constant fear of when the next one will strike. So what do these disorders actually feel like on the inside? To really understand that, we need to dig into the specific symptoms that doctors look for. Now, what's really interesting here is how specific the diagnosis for GAD is. This isn't just worrying a lot. Now, we're talking about excessive worry that's been going on for at least 6 months straight, and it feels almost impossible to control. On top of that, it has to come with at least 3 of these other physical or mental symptoms, like feeling restless, being exhausted all the time, muscle tension, or trouble sleeping. A panic attack, on the other hand, is a whole different animal. It's this sudden explosion of intense fear that hits its peak within just a few minutes. And during that time, a person experiences at least 4 of these incredibly powerful symptoms. We're talking a pounding heart, feeling like you can't breathe, chest pain, and this overwhelming, terrifying fear that you're either dying or literally losing your mind. It is unbelievably distressing. I love this quote from the National Institute of Mental Health because it's the perfect analogy. Just think of a panic attack as a false alarm. It's your body's built-in survival system, that fight or flight instinct going completely haywire. It's kicking into high gear at the wrong time or way too intensely. There's no actual danger, but your body is reacting like there is. And you should know these are not rare conditions, not at all. This chart shows that in the US, about 8% of people, that's roughly 1 in 12, will experience GAD at some point. For panic disorder, it's about 5%, or 1 in 20. The main takeaway here, if any of this is sounding familiar, you are so far from alone. So, how do you even get a proper diagnosis? The most crucial thing to understand is that this is not just all in your head. The physical symptoms are 100% real, and they're often what leads people to seek medical help in the first place. I mean, you can imagine, right? When a panic attack hits, it can feel so much like a heart attack or some other terrifying medical emergency. So for a lot of people, the journey to a diagnosis actually starts in an emergency room or a primary care doctor's office. And that's actually a critical first step to rule out any other physical causes. So the process itself is pretty methodical. First, a provider is going to rule out other medical issues, things like thyroid problems or heart conditions. Then they'll just have a conversation with you about your symptoms and your history. They might use a validated screening tool like the GAD-7 questionnaire before finally making a formal diagnosis based on those official criteria from the DSM-5 we just went over. Okay, so we've covered the what, and now we get to the most important part, the how. How are these conditions actually treated? Let's get into the solutions that are backed by solid evidence. When it comes to medication, this table really lays out the modern approach. The first line, go-to treatments, are antidepressants like SSRIs and SNRIs. They're effective, and they're well-tolerated for long-term use. Now, on the other hand, you have medications called BENZODIAZEPINES. And while they offer really fast relief, they are definitely not recommended for first-line or long-term treatment. Why? Because they come with some pretty significant risks of dependence and withdrawal. And the most important thing to know about antidepressants is that patience is so important. As this timeline shows, it takes time. The first few weeks might even bring some side effects as your body adjusts. But that real, noticeable improvement, that usually starts to happen between weeks 4 and 8. And to prevent a relapse, treatment is often continued for 6 to 12 months after the symptoms have improved. So, medication is one pillar of treatment. Psychotherapy is the other, and the gold standard here is cognitive behavioral therapy, or CBT. CBT isn't just about talking through your problems. It's a super practical, skills-based therapy. It's so effective because it helps you see the direct link between your thoughts, your feelings, and your body's reactions. By learning to challenge those thought patterns that trigger anxiety, you can actually change your response and finally break the cycle. Now, one of the most powerful CBT techniques, especially for panic disorder, is called interoceptive exposure. Now, I know that sounds a little intimidating, but it is brilliant. A therapist guides you in safely and gradually bringing on the physical sensations of panic, like making your heart race by running in place. And the whole goal? It's to learn through direct experience that these feelings, while, yeah, they're uncomfortable, they are not dangerous. It literally rewires your brain's false alarm system. So, with all these powerful treatments available, what's the outlook? Let's talk about empowerment and what the path forward really looks like. Formal treatment is key, but you can absolutely support your recovery with other strategies. Regular exercise is proven to help. Techniques like deep breathing can be a total lifeline during an attack. And even simple lifestyle changes, like cutting back on caffeine, can make a huge difference in making those attacks less likely to happen. And this right here, this is the most important takeaway of all. For people with GAD and panic disorder, recovery isn't just some faint hope, it's the expected outcome. With the right treatment, people get better. These are highly, highly treatable conditions. Just understanding that these are real, common, and treatable medical conditions, that is the first and honestly the most powerful step. So the only question left is, what will your next step be?